Hi, I'm Dr. Lord. I'm a retina specialist from Southern Utah, and I'm going to talk to you today about vitreous floaters. So, floaters are a very common symptom in our practice, and patients describe them in many different ways, but I'm going to talk to you, I'm going to explain what they are and what causes them and what some of our options are for treatment. So, this is a model of an eye, and this is the clear part of the eye called the cornea. This is the cross-section through the color part of the eye called the iris. This is the lens. Light from the outside world comes through the cornea, through the iris, through the lens, through the pupil of the iris, the kind of window, and it's focused on the back of the eye in a specific area called the macula and the fovea, and that's how we see. Inside this structure inside this eye in this cavity here is a structure called the vitreous. When we're born, this structure is very firm and gelatinous, kind of like egg white consistency. But as we age, it kind of changes in composition and it liquefies in some regard. And little tiny condensations of material can collect in the center. And anytime light enters the eye and gets blocked by one of those opacities, it casts a shadow onto the retina, and that's where a patient has those symptoms of something coming in front of the eye, or gnats, or a fly, or spider on the ground, or something on a white wall. They have those symptoms that they're unhappy with. A vitreous is, like I said, it's kind of like egg whites in consistency, and when you move your eye one way or the other, it kind of sloshes around, and those opacities will move as the eye moves and the eye tracks. Now, the vitreous doesn't really serve a function, a great function in adulthood. As the eye develops and as the retina develops, the vitreous has a real big part in development, but it's kind of like your belly button in adulthood. It doesn't really have a function. So what causes floaters? As I said, those little condensations of material inside that vitreous cavity cast shadows on the retina. What are the symptoms? Well, oftentimes, as I said, they see spots or flies or obscurations of their vision. Now, sometimes in the periphery of the eye and the periphery of the retina, they can get a retinal tear, and that will cause bleeding, or it will cause opacities to develop. And so some of the symptoms of vitreous floaters are also related to getting like a retinal tear or a retinal detachment. So we always want to know what patients' symptoms they're experiencing. And the difference between the floater is that little speck that you're seeing inside your vision, and a flash of light, if they do have, the vitreous might be pulling on the retina and the periphery. And anytime the retina is stimulated, either by pressure or by pull, the brain experiences that as light. So when that vitreous is pulling on the periphery of the retina, they can have symptoms of flashes of light. Now, it doesn't mean that they have a retinal tear or a retinal detachment, but it does mean that there is traction in that area. And so we take it seriously. If a patient has new onset of flashes of light or floaters in their vision, we always do a thorough exam to make sure that they don't have something like a retinal tear or a retinal detachment. Who's at risk for getting retinal or vitreous floaters? Well, most patients, as we age, that, as I said, that vitreous changes in composition and becomes more liquid. They'll get some condensations of material inside in that visual axis, and it will cast shadows on the retina and specifically their macula. And so everybody is relatively at risk to develop vitreous floaters. How common is it? Most patients, if you poll the audience, has some vitreous floaters, especially over 45, 50, where that liquefaction of the vitreous has occurred, are going to have some of those symptoms. Now, not everyone is bothered by it. Joe Farmer, plowing fields all day, may have a few floaters and they don't bother him at all. Eddie Engineer, doing a lot of near work, a lot of computer vision, a lot of reading, has a few floaters in his central axis and they bother him significantly. So not only are the floaters varied in symptoms and size and characteristics, the patients that are experiencing those floaters in their vision may also describe them as worse or better depending on their own personal circumstance. What can we do to prevent them? Not a lot. If you're going to get floaters, there's not a lot that you can do to prevent them. Get younger, as they say. Will it fix itself? No. So these floaters, they're not going to go away. Sometimes they can move out of the central axis and be less symptomatic, But anytime that it moves into the central axis, your symptoms are going to get worse. Can we do something about this? Can vision loss be repaired? Can we fix the vision if you have floaters? So nowadays we have a lot of options for patients with floaters. You could do nothing, which depending on your personal circumstance, that might be the best option. We now have lasers that we can go in, and it's called YAG vitreolysis, and we will target the laser at the floater, and it will cause disruption of that floater. It will change in composition a little bit from the blast of that tiny laser, and it will also break that floater into very small pieces and become what could have been a large conglomerate. It can eliminate the symptoms. And if vision loss has occurred, that's how we can repair it, and we can make those symptoms a lot better. When is it serious? Can total blindness occur? No. Vitreous floaters are not going to cause total blindness. This is usually more of a nuisance to a patient's vision, but if they're that type of person that needs that high acuity central forward facing vision, this may be a very big impedance and a great nuisance and affect their activities of daily living, and they need to get this fixed. How emergent is treatment? This typically can occur on a routine schedule. And as I said, we either have that option of a laser to go in and fix that vitreous floater, and if laser doesn't work, we can go to surgery. And surgery consists of, we make tiny incisions into the wide of the eye, and we put a tiny instrument called a cutter, vitreous cutter, and it cuts that floater out and that vitreous out in that cavity, and patients can do very well. So there's your options are you try the laser or you go to surgery. And in my particular case, for my patients, I give them those options. You can live with this. We can try laser, and if laser doesn't work, we can go to surgery. Most patients like to try the laser first because it's safe. It's non-invasive. You don't have to go to the operating room. There's no anesthesia, and greater than about 50 to 75, maybe a little higher, patients, their symptoms can be improved by laser alone. And for those patients that laser doesn't work, we can go to surgery. The surgery is very simple. It's simpler than cataract surgery. It takes about 5 to 10 minutes. We can go in and remove that vitreous and make them very happy with a very simple surgery. The success rate for the laser, as I said, is about maybe 75%. The success rate of the surgery is 100%. We are going to remove those floaters and that vitreous completely and remove those symptoms from them. Complications of those surgery, well, of the laser, it's pretty safe, but we can damage the lens. We sometimes can hit the retina during the laser procedure, but for the most part, it's very safe. It's a very simple procedure for most people that are trained in this. The surgery carries with it the same risks of any ophthalmic surgery: bleeding, infection, damage to the eye, need for a second or third surgery, all rare reported side effects. Now, most patients do very well. It's very well tolerated. Any good retina specialist that performs this surgery is well prepared to deal with any of the complications, but for the most part, this is very safe. And you will regain that vision that you've lost from the floaters and do very well. And that's basically the main points of vitreous vitrectomy for floaters. You usually, after surgery, any vitreous surgery or retina surgery or cataract surgery, need to take it easy for 1 to 2 weeks after surgery, low activity, mild to moderate from 2 to 4 weeks, and normal activity after a month. Of all the retina surgeries that are performed and eye surgeries, this is one of the simpler ones, and patients can do very well and have very good outcomes and very good vision after their surgery. Thanks for watching our video.